Hello, my name is Cielo Games, and today I will be presenting on depression in children and adolescents. This is an important topic because depression is often associated with adults, but it can significantly affect children and impact their development, relationships, and daily functioning. The definition: depression is a mental health disorder that affects moods, thoughts, and behaviors. In children, it may not always appear as sadness. It can also show up as irritability or anger. Depression can interfere with daily life, such as school, relationships, and can also interfere with the parents and the home life. Biological factors. Biological factors include brain chemistry, especially imbalances in neurotransmitters like serotonin, which affect the mood. Genetics also play a role, meaning children with a family history of depression are at a higher risk. Hormonal changes, such as puberty, particularly during adolescence, can also contribute to the development of depression. Cognitive factors. Cognitive factors refer to how children think and process information. Children with depression often develop negative thinking patterns, meaning they automatically think negatively about themselves, others, and their future. They may have low self-esteem and feel like they are not good enough. They may also struggle with concentration and decision making, which can impact their school performance. Additionally, many children experience rumination, where they repeatedly think about negative experiences or problems, which can worsen their depression. Social factors. Social factors are external influences that impact a child's mental health. Family conflict, lack of emotional support, and unstable home environments can increase the risk of depression. Bullying or peer rejection can also lead to feelings of loneliness and low self-worth. Stressful life events such as divorce, moving constantly, or the loss of a loved one can trigger depressive symptoms. Academic pressure and exposure to trauma or violence can also contribute to the development of depression in children. Psychological factors. Psychological factors involve emotional and behavioral patterns. Children with depression often have difficulty regulating their emotions and may experience persistent sadness or hopelessness. They may also show increased irritability or anger. Anxiety commonly occurs alongside depression, and many children lose interest in activities they once enjoyed, a symptom known as anhedonia. They may also experience feelings of worthlessness, excessive guilt, low motivation, making everyday tasks feel overwhelming. Clinical features. The clinical features of depression in children include persistent sadness or irritability, loss of interest in activities, and changes in sleep and or appetite. Children may also experience fatigue, difficulty concentrating, and low energy. In more severe cases, they may have thoughts of death or suicide. These symptoms can vary in intensity, but they significantly impact a child's daily life and functioning, making early identification and intervention is very important. Prevalence. Depression affects about 2 to 3% of children and up to 8% of adolescents. The rates increase as children grow older, especially during adolescence due to hormonal and social changes. It is also more common in females than men during the teenage years. Many cases of depression go undiagnosed or untreated, which can lead to more severe symptoms over time. Overall, depression is one of the most common mental health disorders in the youth. Etiology. Causes. The causes of depression in children are usually a combination of genetic, biological, and environmental factors. A family history of depression increases the risk due to genetic influences. Biological factors such as imbalances in brain chemicals like serotonin and dopamine also play a role. Environmental factors including trauma, abuse, neglect, or major life stressors can trigger depression. Additionally, negative family environments and learned negative thinking patterns can contribute. Depression often occurs alongside other disorders such as anxiety or ADHD, which can make symptoms more complex. Living with depression. Living with depression can affect many areas of a child's life. In school, they may struggle to concentrate, leading to lower grades and frustration. Adolescents may not be able to find motivation to go to school and start skipping once they're able to drive to school. Socially, they may withdraw from friends or have difficulty maintaining relationships. They often experience low motivation and lack of energy, making daily tasks feel overwhelming. Depression can also affect sleep, appetite, and self-esteem, and may lead to increased conflict with family members. They can accept their sleep by sleeping too much or sleeping too little. It can affect their appetite by eating too much or not eating at all. Overall, it significantly impacts their quality of life and daily functioning. Treatment. Treatment for depression in children often includes a combination of therapy, support, and sometimes medication. Cognitive behavioral therapy, or CBT, is one of the most effective treatments as it helps children change negative thought patterns. Interpersonal therapy focuses on improving relationships and communication, while family therapy helps create a supportive home environment. In some cases, antidepressants medications such as SSRIs may be prescribed and carefully monitored. Schools can also provide support through counselors and accommodations. Teaching coping skills such as emotional regulation and stress management is also very important. Early intervention greatly improves outcomes. Summary. In summary, depression in children affects emotional, cognitive, and social functioning. It can present differently than in adults, often showing as irritability rather than sadness. It is caused by a combination of biological, psychological, and social factors and can significantly impact a child's daily life. However, with early identification, proper treatment, and strong support systems, children with depression can improve and lead healthy lives. Here are my references that I used for this presentation. Thank you so much.